Welcome to the Dr. Mudgil podcast. This is episode 160. We are smack dab in the middle of December here. It's cold. Winter is here. It was actually very warm and rainy yesterday, but it's very cold and windy today. So it feels like winter, which is what it should be doing. And I'm just going to dive right in because there's a lot to go over here. So, my last podcast was basically, I was referencing videos that I'd posted years ago about just how shitty UnitedHealthcare is. And, because of like the tragic events of last week, violence is never the answer. I just want to, put that out there. And, any acts like that are absolutely deplorable and reprehensible. But, because of what happened last week, those videos from years ago are now starting to just go absolutely viral. And just kind of give you like a little recap. Back in 2021, I was literally just being, UnitedHealthcare was pulling like, really, quite frankly, like a white collar mafioso style shakedown of me. And it was just many, many months of just this ongoing frustration dealing with United at the height of the pandemic when I was short-staffed, and it was a very stressful time to be practicing medicine in New York City. I was one of the only dermatologists that were open during the pandemic. Most of the dermatologists in New York City were posting on their social media that, we're doing the right thing and we're like shutting our offices down, and they were posting from their homes in the Hamptons. And I thought they were absolute cowards. I thought doctors were doctors. We run towards a pandemic, not away from a pandemic. And I used to schlep into New York City with my staff, when there was so much unknown about COVID. Many around me got COVID during the height of the pandemic, including my assistant and, various other folks. And, during all of this time when we were short-staffed, I was like, barely scraping by. I still had to pay my staff, pay my rent and all that other sort of stuff. All of the stuff that any small business owner would have to do. UnitedHealthcare was shaking me down. It was some total bullshit audit that was like rooted in absolute, I don't know. It was rooted in absolute crap. They were literally shaking me down, and I just lost it. And I made a post, at the height of my frustration with them, where it basically, the opening line is essentially, "Fuck you, UnitedHealthcare."
UnitedHealthcare, fuck you. That's right. Fuck you, UnitedHealthcare.
That was in 2021. That video really captured how frustrating it was for me and every other doctor to deal with this vile, disgusting institution. And, unfortunately, it took something like what happened last week, which is very unfortunate, to, shed a light on just how frustrated patients and their doctors are dealing with these vile private health insurance companies like UnitedHealthcare. The others are terrible too. Aetna, Cigna, Blue Cross Blue Shield, you name it. They're all horrible, but United is the leader of the pack, the absolute most vile of the bunch. And, that video has been getting like just tons of views in the last week or so. And there's lots of comments and lots of comments that, to me really capture just, how much, change really needs to happen. I mean, our healthcare system is broken. I've said this many times in many podcasts, there's no purer relationship than the doctor-patient relationship. Patients come to their doctor because they want to get help for a problem. Doctors go to like 1,000,000 years of schooling and give up their entire decade of their 20s when all their friends are partying to help patients. I mean, it's like a passion that we have. And private health insurers, sprawling hospital systems and private equity companies get smack dab in the middle of that doctor-patient relationship and just try to extract as many dollars as they can off the backs of patients and off the backs of doctors. And it's an absolutely disgusting system where the only people benefiting are these horrible private health insurers like UnitedHealthcare. And, all of us, patients and their doctors are just getting absolutely fucked by these private health insurance companies. So I want to share some of the comments, and just maybe add a little bit of commentary. I'm an old man now, getting blind, can't see close up, so I gotta put my specs on for this. All right, so I'm gonna share a couple of these comments. First one: my mom sold her practice to Optum and they absolutely are harassing her and creating an intimidating work environment to push her out of the practice she ran for 20 years. They've absolutely destroyed patient care, and they treat her like a work dog. They're the absolute worst. Well, this is classic. So as crazy as it sounds, UnitedHealthcare, through their, the company that they own called Optum, Optum controls a lot of things. They control payment to doctors. They control pharmacy benefits. And now they're buying practices. So there's doctor's offices that UnitedHealthcare owns through Optum. And they're these multi-specialty practices. They're all over the place. And it's so incredibly shady because they own the doctors, they own the practices that the doctors work at that, United also is reimbursing those doctors. It's just this crazy monopoly. And it's not surprising to me. So a lot of independent mom and pop shops like my own get usurped by either sprawling hospital systems, private equity, or now Optum. And, all they really care about, not all they really care about, the only thing they care about is maximizing their profits. And this is all done by denying patients benefits. And then, as doctors, it's not like you see the doctor and the doctor gets paid right away. We have to submit our claims, and then we have to, they play their games where they need to review our notes, and then they all, need some other information, and they try to delay paying us as long as possible. So, sometimes we've seen a patient and 3 months later, we get a denial that, oh yeah, we're actually not going to pay you for that. It happens more than you think, believe it or not. And that was part of what this whole shakedown was with United with me years ago. So it doesn't surprise me. They literally will buy your practice, work you to the bone, because they want the person who actually cares about that practice, who built that practice, who has a relationship with their patients. They want them out. They want them out the door because they don't want any compassion in healthcare. They just want patients and doctors to be cogs in their machine to just generate dollars for their shareholders. That's literally what it is. So I totally get what's happening to this lady's mom. Next comment. I'm a family medicine physician. UnitedHealthcare is the worst insurance company and has been for decades. I canceled my contract with them for at least 15 years. Or at least 15 years ago, because they were so frustrating to deal with. My life has been much better since then. I would encourage all physicians to do the same if you can. I'm self-employed, so I was able to do this. I also do not work with Blue Cross Blue Shield. That's happening all the time. Doctors are just dropping insurance plans because it's so incredibly frustrating working with them. I totally see what this guy is saying. Problem is, patients really suffer. So UnitedHealthcare has a huge market share in the New York City area. And where are those patients going to go? It's a much better strategy would be for us all to speak up and fight against the insurance companies. The interesting thing was, 3 years ago when I posted this video about UnitedHealthcare, I would get all of these direct messages and emails from my colleagues saying, "Hey, I'm so glad you said something, and just keep it up." But not a single one of them went public, said anything publicly. Now you see folks talking about it, coming out of the woodwork, because apparently this last week, whatever happened, the awful events of last week have made it a little bit more appropriate for doctors to speak up and talk about it. But doctors are cowards. My colleagues are cowards. They're getting screwed by UnitedHealthcare. Yet, they're behind the scenes. They were we all got to say something. We all got to do something. Not a single one of them said shit 3 years ago. Hopefully now there'll be a little bit more momentum, and some folks will be a little bit more vocal and just try to get the ball rolling here while we have perhaps a little bit of momentum for change. So doctors, I'm talking to you. You guys need to stop being so wimpy and get out there and advocate for your patients and for yourselves. Next comment. I don't even know if I need my glasses for this one. Worked at UHC as a sales agent. Everything was disguised as we are here to help consumers. Pressure to sell plans, even if it's not good for the consumer. We're told to think about our commissions. Of course, UnitedHealthcare only cares about their bottom line, all on the backs of patients and their providers. This needs to be covered by the fucking news. I've been working in healthcare for 10 years, fighting tooth and nail just to get them to pay for medication or treatment that a patient desperately needs. I agree. The interesting thing is, even now, with what happened last week, you'll see a couple of articles here or there that say basically captures the rage of patients and doctors, but it's not really at the forefront of the coverage here. And I think a big reason for that is, and call me a conspiracy theorist, but when I watch TV, there's a million commercials for UnitedHealthcare, or from Aetna, or from Pfizer, or all of these huge healthcare companies that, I'm pretty sure, like, legacy media outlets like, CBS, NBC, ABC, CNN, none of them want to bite the hand that feeds them. So they're not going to talk shit about UnitedHealthcare when, that's who's paying them in these crazy advertising dollars. So that's why it's not covered by the fucking news, in my opinion. So true. This is why people can't get into a doctor, because they're spending all their time on arguing with insurance companies. More true today, 2024, than when you made this video. Yes, a huge percentage of our time is sending notes in, faxing notes in to UnitedHealthcare, getting prior authorization for our patients. Even generic medications now, something that literally costs like $10 is getting denied by UnitedHealthcare. It is absolutely criminal. All right, next one. Wow. Thank you for sharing this awful though helpful information. I have UHC, and the one time I tried to use them to cover the cost of a $25 cane, they put me through such a ridiculous hassle for 3+ weeks. The same kind of back and forth useless nonsense as described in this video. I was finally awarded Medicaid, who then covered me for the cost of a cane within less than 1 day. And shortly after that, I was able to purchase a second cane at Aldi for $8. Yep. Delay, deny, delay, deny, delay, deny. And that's just what UHC wrote the playbook on this, but that's what all the private health insurers do. The latest thing United is now doing is that when they pay doctors, they pay through Optum Pay, which is a subsidiary of Optum owned by United, and they charge 0.5% fee for making the payment. Well, it's actually not 0.5%, it's several percent. This is the most infuriating thing. So I see a patient, I wait friggin' 3 months to get paid because I have to send my notes in and all this other bullshit that UnitedHealthcare makes me do. Then I finally get a payment by Optum Pay, which United owns, and they take like a 2 or 3% cut of the payment, credit card processing fee for what I'm supposed to get paid, by the health insurance company. It is absolutely crazy. I don't know why no one is talking about this. Doctors, I'm talking to you. You need to be more vocal about this. And of course, our legislators who are in bed with these fucking criminals and are not going to do anything about it because they're on their payroll as well. It's up to us, private citizens, to be vocal about this nonsense. I mean, it is just absolutely egregious. My head is going to explode. All right, here we go. Yes and amen. UHC is absolutely an evil institution that unlawfully denies care. We run into this all the time with all of our prosthetic patients with UHC. We get the same lies and the same runaround of them losing our notes. And what really pisses me off is that when they use an amputee in one of their recent commercials, we have to fight for at least a year to get coverage for a basic prosthesis for our patients. Delay, deny, delay, deny, delay, deny. Classic. Next one. Nearly all of my patients insured by UHC, processed by its Optum, never see any insurance payment because of the various excuses of denial, mainly medically unnecessary or high deductible. Does it make any sense to buy the insurance that will never pay? Nowadays, healthcare is dictated by greedy business people, insurance companies, based on their profit. Medical professionals' hands are tied while paying for malpractice insurance to cover consequences of delay, deny, defend, and depose by insurance. That is absolutely correct. Health insurance companies like UHC are basically tying our hands that, if there's something that happens, like, when something that a poor outcome for one of our patients, guess who gets sued? The doctor, not UnitedHealthcare. It is absolutely criminal. I agree 100%. Next one. Thank you so much for speaking out. I'm a private behavioral health provider, mental health and substance abuse disorders in Idaho, although I was born and raised in Brooklyn, New York. Optum is the primary managed care organization for Medicaid clients in our area. Before Optum, my small agency had a reasonable profit margin and a huge success rate in assisting our client to make excellent progress. Our ability to profit allowed us to give more back to the sick and suffering in our community, as well as provide our staff with decent pay raises, specialized trainings, continued education, health insurance, etc. Since Optum has monopolized our area, I've had numerous silent strokes on both sides of my brain. I contribute this sad reality to having to work 10 to 12 to 15 hours a day to keep up with their admin demands. I've depleted my savings to keep our doors open. I'm unable to take proper care of my team or provide clients with the fun activities we used to do. So much time and energy for very little money is spent on jumping through Optum's hoops. There's little left for a primary purpose of the client. As of lately, our ability to make progress with those we serve has greatly diminished. I hope I'm not penalized for speaking out because I have been in the past. So again, this kind of obviously it's tragic. Optum obviously doesn't give a shit about your patients or you. They just care about, their dollars. And it's so sad to think that you're afraid of them lashing out. I mean, they're certainly capable of it, I'm sure, but it's crazy, right? I mean, that's why none of the doctors in 2021 that were like talking to me privately and saying, hey, yeah, good job. We're going to say something. That's why none of them said anything. It's absolutely insane. We all must speak up. Patients and providers, we all must be vocal about how just awful, vile, disgusting, immoral. I mean, these are morally bankrupt companies that are running healthcare. As a society, we need to step up and we need to say something about it. Next one. That's insane. My mother has UHC and they denied her CT of her chest for almost half a year because she kept coughing nonstop. April 2021, she had to be admitted because she couldn't breathe, only to find out that she had lung cancer stage 4. I was so devastated. UHC is the fucking worst. Yes, they are the fucking worst. Again, delay, deny, delay, deny, delay, deny. And I've said this in a separate podcast. Your healthcare company, your health insurance company, I should say, absolutely loves you when you're healthy, you're paying your monthly premium, you're not using your insurance at all. They're just like sitting on that cash and investing it, doing whatever the hell they do, and generating billions and billions and billions of dollars. I think some of these CEOs make like literally $20 million a year. But the second you get sick, like your mom you're describing here, they literally wish death upon you. They want you to die as fast as possible. The second you're going to cost them $1 and cut into their profit margin, they want you to die. That is the sad reality. Think about that. That is insane. That's who runs healthcare. Companies like this, they literally want you to die when you get sick. Next one. Oh man, where to start with this? I work at a urologist's office and I'm in charge of scheduling radiology, imaging, and getting authorizations for those scans. I cannot tell you the hardship and runaround I get from UnitedHealthcare. When I schedule high-tech imaging for patients that were just diagnosed with cancer to see if it has metastasized, only to be told that UnitedHealthcare and many other insurance companies that they are denying the request. I've received denials because their cancer was not serious enough. Part of the problem is these third-party vendors that insurance companies have hired to decide whether or not imaging is needed. These third-party vendors have their own quote-unquote guidelines they follow, but not what the actual patient's physician is requesting. How can insurance companies dictate healthcare and play God with patients' lives? It's so frustrating. I ask myself the same question every day. It's absolutely insanity and it's sad. All right, this is I think this is the last one. All right, and this is the one that's really kind of gut-wrenching. I've been an RN for almost 20 years. I worked in adult leukemia, and what insurance companies do is criminal. Acute leukemia needs to be treated immediately, and for some, a clinical trial is their best and only hope. Even for patients whose coverage includes clinical trials, the insurance more than often not drag their feet on approving treatment. These patients need treatment or they die. The insurance companies know that if they deny treatment long enough, many patients will die waiting. This puts physicians in an impossible bind. If they go ahead and start standard of care treatment, this may give the patients a little more time, but the patients will no longer qualify for the clinical trial due to washout required from prior chemo. If the physician tries to wait for the insurance company to finally say yes to the clinical trial, by the time the insurance company says yes, the patient may have deteriorated too much to qualify for the trial. I often heard the physicians upset because the insurance company wouldn't just say yes or no, but just kept dragging it out. Horrible thing to do to the patients and the physicians. Well, that pretty much sums it up. Like I said, if you're healthy, your health insurance company, UnitedHealthcare, they love you. You're paying your premium. They're sitting on that pot of cash, and they're just, investing it in their things and making, more and more money for their shareholders. But the second you start costing them money, it starts taking money out of that pot of cash they're sitting on. And quite literally, like you're describing, they wish death upon you. So as I've said, it's up to patients and their doctors to be as vocal as possible. Our elected officials aren't going to do shit for us unless we make them do shit for us, because they're in bed with these criminals. Our media groups aren't going to advocate for us because guess what? UnitedHealthcare is paying like gajillion advertising dollars, and the networks aren't going to jeopardize that flow of revenue. So it's up to us, patients and docs, to shed as much light as possible on how vile and disgusting private health insurance companies are. So with that, I hope you all have a wonderful, restful weekend. Let's get it.